You've been told your whole life that vegetables are always healthy, but what if I told you that some vegetables could actually be dangerous for seniors? That's right, certain veggies, the ones you may be eating every single day, could be silently sabotaging your health. From hidden blood pressure spikes to unexpected digestive disasters, we're uncovering the 8 vegetables seniors should never eat and the shocking reasons why. Some of these might already be in your kitchen. Be sure to watch to the very end, because the last one is one most doctors never mention, and it could be the most dangerous of all. And if you care about health tips that actually matter, tap that like button and subscribe so you never miss a life-saving video. Spinach, the superfood with a secret side effect. Spinach has long been hailed as a nutritional powerhouse, loaded with iron, vitamin K, and antioxidants that fight aging and boost immunity. But here's what most people don't realize. For seniors, this leafy green may do more harm than good if consumed in excess. You see, spinach is packed with something called oxalates. These sneaky compounds can bind to calcium in your body and lead to the formation of kidney stones. And trust me, those tiny stones can cause big pain, especially for older adults who are already at higher risk. But that's not all. Oxalates also interfere with your body's ability to absorb calcium, which is bad news for bone health. And let's be honest, keeping bones strong becomes more critical with every passing year. And if you're taking blood thinners like warfarin, that vitamin K in spinach can actually counteract your medication, increasing the risk of blood clots. Here's a smarter swap. If you love your greens, try lightly steaming spinach to reduce oxalates and rotate in low oxalate options like arugula or crisp romaine lettuce for a safer, senior-friendly salad. Sprouts, a crunchy snack or a hidden health risk. Sprouts like alfalfa, mung bean, or clover might seem like a light, healthy addition to your salad or sandwich. But don't let their innocent appearance fool you. These tiny greens are actually grown in warm, damp environments, the exact conditions that harmful bacteria like E. coli and Salmonella love to thrive in. Now, while a younger immune system might bounce back from mild food poisoning, seniors aren't so lucky. As we age, our immune defenses naturally weaken, making it harder to fight off these nasty bugs. And what might start as a little stomachache can spiral into serious complications like severe dehydration or even hospitalization. In fact, outbreaks linked to raw sprouts happen more often than you might think, and they're especially risky for older adults. A safer swap. If you love that crunch, try lightly cooked sprouts to kill off bacteria, or go with crisp, refreshing alternatives like cucumber slices or shredded carrots. You get the texture without the risk. Corn. Not so sweet consequences. Who doesn't love a juicy ear of corn on a summer day? It's sweet, nostalgic, and feels like a healthy choice. But for older adults, corn might not be as friendly as it seems. Here's why. Corn contains cellulose, a type of fiber that the human body simply can't break down. And as we age, our digestive systems slow down, making it even harder to process. The result? Bloating, gas, and that uncomfortable feeling of fullness that just won't go away. But that's not all. Corn is also high in carbohydrates, and those carbs quickly break down into sugar. For seniors managing diabetes or pre-diabetes, this can send blood sugar levels spiking, creating a roller coaster of highs and crashes that's tough on the body. Portion control tip. If you can't resist the occasional corn on the cob, just keep portions small and pay attention to how your body reacts. Moderation is key, and your gut will thank you. Bell peppers. Bright, crunchy, and surprisingly problematic, bell peppers are often seen as a go-to healthy snack that's colorful, crunchy, and packed with vitamin C. But here's what many seniors don't realize. For some people, these veggies could be doing more harm than good. Bell peppers belong to a group of vegetables called nightshades, a family that includes tomatoes, eggplant, and white potatoes. These foods contain natural chemicals called alkaloids, including solanine, which can trigger inflammation in certain individuals. If you're dealing with arthritis, joint pain, or autoimmune issues, and let's face it, that's a lot of seniors, nightshades like bell peppers can quietly worsen your symptoms. Think stiff joints, flare-ups, and that nagging pain that just won't quit. But it doesn't stop there. Bell peppers also come with tough skin and seeds that can aggravate sensitive digestive systems. For older adults dealing with irritable bowel syndrome, GERD, or general gut sensitivity, eating peppers could mean bloating, gas, or an uncomfortable stomach. Here's the kicker. Most people never suspect veggies. Doctors usually tell you to cut back on sugar, salt, or fried foods, but vegetables? Hardly ever. That's why bell peppers can fly under the radar as a hidden culprit behind chronic discomfort. Pro tip. If you suspect nightshades might be affecting you, try cutting them out for a few weeks and see how your body responds. You might be surprised at how much better you feel. Quick reminder, if you're loving these tips, make sure to hit that like button and subscribe so you don't miss out on more health tips just like this. Canned veggies might seem like a smart choice, affordable, shelf-stable, and easy to prepare. But don't be fooled by the convenience. For seniors, these quick fixes can quietly pack a dangerous punch. The biggest red flag? Sodium. Many canned vegetables are absolutely loaded with salt, sometimes packing an entire day's worth into just one serving. For older adults already dealing with high blood pressure, kidney issues, or heart disease, that extra sodium can be a recipe for serious trouble. Too much salt increases the risk of stroke, damages your kidneys, and puts extra strain on your heart, things that seniors simply can't afford to ignore. And here's something most people don't think about. The lining of many cans contains BPA, a chemical that can mess with your hormonal balance. That's especially concerning for older adults whose hormone levels are already shifting with age. Here's a healthier move. Opt for fresh or frozen veggies when you can, and if you must go canned, choose low sodium or no salt added options, and give them a good rinse before eating to cut the salt even further. Mushrooms are often seen as a healthy, low-calorie food that adds flavor and texture to meals. But before you toss them into your stir-fry, there are a few things every senior should know because these fungi come with more mystery than meets the eye. First up, wild mushrooms. Unless you're a trained expert, it's incredibly easy to mistake a toxic mushroom for a safe one. Some deadly varieties look almost identical to their edible cousins, and the consequences can be fatal. We're talking nausea, liver damage, and even death from a simple foraging mistake. But even store-bought mushrooms have a lesser-known risk. Many contain a naturally occurring compound called agaritine. In animal studies, agaritine has been linked to tumor growth and potential cancer risks. While human studies are still ongoing, it's enough to raise concern, especially for seniors whose bodies are more vulnerable to long-term exposure. A smart strategy: always buy mushrooms from trusted sources, no foraging, no guesswork, and cook them thoroughly. Heat helps break down potentially harmful compounds and makes mushrooms easier to digest. Potatoes. Baked, mashed, or fried, they're a staple in so many meals. But for seniors, this beloved comfort food can turn into a silent saboteur of your health. Here's why. Potatoes have a high glycemic index, meaning they break down quickly into sugar in your bloodstream. This causes blood sugar to spike fast. And for seniors managing diabetes or insulin resistance, those spikes can lead to energy crashes, weight gain, and increased risk of heart disease. But that's not the only concern. When potatoes are cooked at high temperatures like baking, roasting, or frying, they can produce a chemical called acrylamide. This compound has been linked to an increased risk of cancer in animal studies, and while human research is still evolving, it's enough to raise red flags, especially for older adults. Healthy habit. If you love potatoes, don't worry, you don't have to give them up entirely. Boil or steam them instead of frying and pair them with a source of protein or fiber like beans or leafy greens. This helps slow down digestion and keeps blood sugar levels more stable. Beets are often promoted as a miracle food, great for heart health, blood flow, and even brain function. But here's what most nutrition labels and health gurus won't tell you. For seniors, beets can quietly cause some serious health issues. Let's start with oxalates. Beets are loaded with them. These natural compounds can lead to the formation of kidney stones, and for older adults, the risk is even greater. Why? Because kidney function tends to decline with age, and staying fully hydrated becomes more of a challenge. That means oxalates can build up faster, creating sharp, painful stones that are tough to pass. But that's not the only red flag. Beets are also high in nitrates, which are known to help lower blood pressure. Sounds great, right? Well, not always. If you're already taking blood pressure medications, beets can double down on the effect, potentially dropping your blood pressure too low. That can cause dizziness, fainting, or dangerous falls, a major concern for seniors. And here's the kicker. Most doctors don't even bring this up unless you specifically ask. The interaction between beets and certain heart or blood pressure meds often flies under the radar, a smart approach. If you enjoy beets, talk to your doctor first, especially if you're on any medications for your heart or blood pressure. And consider limiting portion sizes or choosing lower oxalate vegetables to keep your kidneys in the clear. Aging gracefully doesn't mean giving up the foods you love, it means eating smarter. You don't have to cut out all the delicious vegetables, but understanding the ones that could pose hidden risks for seniors is key to maintaining your health and well-being. By making informed choices about what goes on your plate, you can continue enjoying a vibrant, active life without compromising your health. It's all about finding that balance and listening to your body. Remember, always consult your healthcare provider before making any big changes to your diet, especially if you have existing health concerns. They can help guide you in making the best choices for your unique needs. Now, we want to hear from you. Do you eat any of these vegetables regularly? Which one surprised you the most? Let us know in the comments below. And don't forget to hit that like button, subscribe, and share this video with someone who's committed to healthy aging. If you want to dive deeper into which foods are the best for seniors, make sure to watch this next video.